And now I'd like to welcome Brian Deakins, the National Family Preservation Specialist, to come up and introduce our next presentation.
Thank you, Heidi, and welcome everybody back from what I hope was a great lunch. The first little housekeeping thing is that on each of your tables you will find the handouts for today's session. So those aren't leftovers from the last session, but those are going to help you as you move along through this one. As Heidi mentioned, my name is Brian Deakins. I'm the National Family Preservation and Family Support Specialist in the Capacity Building Division in the Children's Bureau. And it's my pleasure to introduce you to our second general session, which is entitled Integrating Data to Facilitate Systems Change. I'm a relatively new or recent addition to the Children's Bureau, and I was introduced to our next two speakers about a year ago, last July, at the Children's Bureau's 2007 Data Conference. This was pretty much my first national event that I attended that the Children's Bureau was putting on. And I recall from that meeting a couple of things, but importantly that not only was the knowledge about data and systems that was shared by these two individuals, but that our speakers really shared their curiosity and their passion about data and how to make numbers useful to you, and I'm sure we're going to hear some very important words from them today. So I'm very pleased to introduce Dr. Penelope Meza and Ms. Linda Arnold. Dr. Penny Meza is the Senior Policy Research Analyst for the Children's Bureau. In that capacity, she analyzes data reported to the Adoption and Foster Care Analysis and Reporting System, or AFCARS. She conducts data analysis for the Adoption Incentive Program and provides consultation to other federal, state, local, and private child welfare agencies and organizations. Her previous government positions include Chief of the Assistance Branch for the Children's Bureau, Chief of the Evaluation Branch for the Administration for Children, Youth, and Families, and Research Sociologist at the National Institute on Mental Health. She also served as Research Director for the Child Welfare League of America and as Assistant Professor of Sociology at the University of South Florida. She has published numerous articles in the child welfare field. Linda Arnold is the Director of the National Child Welfare Resource Center for Data and Technology. She was previously an Associate Director with the National Child Welfare Resource Center for Organizational Improvement. Ms. Arnold has over 35 years of experience in social services. She retired from the Oklahoma Department of Human Services after 29 years of service, the last 6 of which she served as the Child Welfare Director. Since that time, Linda has been consulting on a national level where her major areas of focus are organizational development, strategic planning, and using data to improve practice and outcomes. Please join me in welcoming Dr. Penny Meza and Ms. Linda Arnold.
Thank you, Brian. Can you all hear me? Am I on? Okay. As being one of the elderly people in the Children's Bureau, it's always nice to see the young folk who are taking over. So Brian is one of our young people. I refer to them as this group of young people, the ones under 60. So it's really... Just a few remarks before I begin the formal presentation. You'll note at the bottom of each of the slides it says, please consult with author before quoting. The reason for that is that when I do a presentation such as this, I consider the material that I'm presenting to be draft because I'm still working on it. And in fact, this is the first presentation of the fiscal year 2007 data. So it's still being massaged, and in fact, you may see some error things in here. So if you're going to quote this in, say, a widely distributed newsletter or to the press or anything like that, send me an email and I'll tell you whether or not things have changed or whether I still feel comfortable with the data because it's still in the developmental stage. Things that I do in the fall are still very developmental. Second of all, for many of you, you probably avoid data sessions like the plague at conferences. My roommate, when I was studying for my advanced degrees, was somebody in an MSW program. And the big differences between our programs were around whether or not we had to take statistics and how much. And so I certainly am sympathetic to that. And so you've been able to probably systematically avoid these kinds of presentations. However, that is not permissible in the Children's Bureau anymore. We force it in plenary sessions. So I hope that although it's an after-lunch session, we'll try to keep it lively enough that we won't totally nod off. If you do, I might call your name and embarrass you. The other thing to remember is what I'm presenting today are national data that have been reported to the Adoption and Foster Care Analysis and Reporting System over the years. Your state is probably going to differ in some way from what the national data say. In fact, we expect that. The national data is just, we put it all together, we run it for you. In work that I've done in the past in this area, particularly with the adoption managers, my friends out there, the adoption managers, is that what they will do is they go back to their analysts and data people in their states to see whether or not they look like the national data. And if they don't, trying to figure out why, what makes them different. So this is not the end point for what goes on back in the States, but is really a beginning point about how to ask various kinds of questions. So that's sort of my introductory piece here. Okay, get my watch out. Okay. What we're going to do is we're going to just do some context very briefly and then go into the particular topic today, which is about living stability. When Heidi asked me to present in a plenary, she said, well, you know, something that's going to be of interest to everybody. Well, that's not an easy task, Heidi, let me tell you. I had to think long and hard as to what topic area might be of interest to everyone. And it just so happened, I just had a paper published with some other authors regarding the importance of living stability, whether you're in or outside the foster care system, having great consequences for child development. So I thought, well, we'll take a look at the AFCARS data, which focuses on children in foster care, is about children in foster care and being adopted, and look at issues around living stability. So movement in and out of various stages, and that's what we're going to talk about today, and to see what the AFCARS data tells us about that phenomena. So we'll start off with context. But anyway, this chart, it's called the trends chart. We have it on our web page, although it only goes from 2002 through 2007 on the web. But I'm having trouble getting rid of the older years. I'm having, you know, a separation problem. So I keep, for my presentations, I keep all the years in, even though it gets harder and harder to read. Because we now have 10 years of data. It's a miracle. Those of you who have been around as long as I have remember when we used to make it all up. You don't think we did? At one point, my Social Security number was the estimated number of children in care, the first 6 numbers. And when we wanted to know what was happening, we would call Illinois because they had good data. We'd find out what they said. We would generalize to the country. That was in the early 80s. That's how bad it was. So we've come a long way since then. Actually, I have a very funny piece I do on that, but I won't bore you with it. But to give you an idea of what is happening, in the first column, first of all, I really encourage you to go to our website because there are lots of notes and definitional stuff that's associated with this so that the data are used correctly. But the first column is really that in-care count. But 9/30 is at the end of our fiscal year, so we do a one-day count at the end of the fiscal year. And you know, when people ask how many kids are in care, that's the number that you'll usually get. And what's real interesting about it is we have now, this is the first time publicly announced, in FY07, we have broken the 500,000 mark. This is really quite an achievement. I don't know how long it's going to last or if it's a fluke, but we can at least for the moment bask in the sun of having broken the 500,000 mark. We've gone from a 559, and then we went up to 567. The early days of the data system, things weren't real stable. And since then, other than a brief pause a few years ago, we've been going down, and we estimated 496,000 children in care on a single day. If we look at entries, we will see that there has, in recent years, been a drop in entries. We're down, again, below 300,000. Somebody asks you how many kids, if somebody ever asked you how many kids are there in care, Dashley, if you really have to just make it up on the spot, just say 500,000. And if they say how many kids enter every year, if you have to make it up, you say 300,000. We never knew this stuff before. In terms of exiting care, there are some issues around the exit counting that are specified in the notes having to do with this chart. I hope you'll read. So it's an underestimate of exits. But the exits have been kind of stable. There are a count of waiting children. Waiting are the kids who are in waiting status at the end of the fiscal year. Those are children. The definition that we use analytically, there is no federal definition, no official definition, are children either with a goal of adoption or with a TPR, whose parents are TPR, or except for children 16 and older who have a TPR, who have a goal of emancipation. And those of you in the adoption session on Wednesday will get more detail about that. But that's the definition that we've been using over the years. And actually, that number's been very stable over the years. Right now, we're sitting at about 130,000. Our TPRs are going up as a proportion of waiting children. We're up now in 07 to about 84,000. That's as high as it's been that we've been able to count them. Adoptions, which those of you who know me know that's been sort of my specialty over the years, had really kicked up early in the data collection, and then by 2000 it hit around 50,000, and since then it's been hovering in the low 50,000s. It has not increased as people anticipated as part of the Adoption Safe Families Act. It's just been sitting there for all those years, for 8 years. And total served, we're down a little bit, 700 and something, I can't even see it, 83 I think. But basically we generally have about 800,000 children come through the system every year. So that gives you sort of the context in which we're working. There we go. What we're going to talk about today are looking at children entering care compared to children who re-enter care, because I think that has a lot to do with your family preservation and support and preventive services. Something about children who are in stable placements versus movers, children who are moving while they're in placement, again, living stability as the issue. And third, the first time that I'll be presenting this data in this level of detail, something about children who enter care after having been adopted and who and their adoption remains legal versus those children who are in a dissolved, their adoptions become dissolved, and looking at the differences between those two groups. So that will be really quite entirely new information. All right. So let's look a little bit at entries versus re-entries. We're going to look at race ethnicity a lot, but you'll find that only in a very few circumstances is it huge differences. AFCAR's data is, because the number of cases in the AFCAR's data are so large, don't ask me if it's significant, because everything is significant. It's a population, we don't even test it. When we're talking about hundreds of thousands of cases, you wouldn't even test it. those of you who remember your statistics class, you could actually go up to 1,200 cases, and beyond that, everything's significant. We're talking 800,000 a year, so you can imagine everything's significant. So what you have to look at in AFCAR's here, a couple things you have to look at. Well, how big are the differences among various groups? And has there been some sort of trend? And I've said in other talks that I give that sometimes it's very hard to see trends in AFCAR's data because so many cases have to move in the same direction for there to be a trend. It has to be like 10,000 cases move. So some things you'll see are really stark and some things aren't. With regard to race ethnicity and comparing the blue bar are first entries, the red bar are re-entries, and we can see that the African American children are slightly higher in re-entries, but it doesn't really knock your socks off in terms of the difference. I mean, it's some difference. Hispanics are slightly less, and white non-Hispanic children are also slightly less. But it's not huge differences between entries and re-entries. Where you start to get some real differences between first entries and re-entries is certainly in the age distribution. I mean, that's not a surprise. Clearly. I mean, in order to re-enter, you have to be a little bit older because you've already been in once. What has been, I've done some more extensive analysis on this, is really how much different they really are. That most of the re-entries occur much later in the child's life. There was always this feeling early on, this is 2007 data, when I first came in the field in ancient times, that kids were just bouncing in and out of the system all the time. Now, we don't have data to show whether or not that was really happening. But what this data tends to show is that kids come into care and then leave, if they leave, and then re-enter really at much older ages. And you can see in this distribution how much older the re-entries are. Each of the bars represents the age at entry, from 1 year all the way up to 17. And you can see the first-time entries cluster in the very young ages, and the re-entries cluster in the older ages. And so it really is more than just a little function of age. It's a big function. And again, those of you in the preventive end of child welfare, and Linda will probably talk about this, it says it's a different message about what kind of services are needed because you've really got a very different age distribution going on. I don't want to step into your stuff. Sorry about that. Okay. Now let's look at the reasons for removal, the circumstances. We don't call them reasons. Circumstances. Now this is multiple response. Rather, the workers in entering the data can identify any number of circumstances that they want to. So this is a distribution based on all those responses. And you can see that again, you can see it's very much related to age. Your first entries have high rates of neglect and parental drug abuse and physical abuse. And when you get to the re-entries who are older, you get the message again. In this case, they're higher in caretaker inability to cope and child behavior problem. 1 in 5 children who are re-entries are child behavior problem, compared to 57% coming in at first entries are neglect. I guess the message is these populations are very different and obviously need different kinds of addressing their problems in different ways. These are the kinds of placement settings that they're in. And you can see that our first entries, and it's probably related to age as well, are in foster family homes with relatives, 29%. Foster family homes with non-relatives at 45%. So most of them are really in those kinds of settings. On the other hand, although many of the reentries are also in foster family homes with relatives and non-relatives, they exceed the percentage of the first entries in group homes and institutions. Again, that's not a shocker, but it does give you a sense that they really are different groups. So that gives you a sense of what's going on between entries and reentries, and Linda will probably talk about some of the implications. What does it mean when you're trying to prevent a reentry versus a first entry? Maybe a very different phenomena. The second thing I wanted to talk about was placement stability. Those of you who have been following the CFSR know that that's been one of the places where the states have had really a real challenge keeping kids from moving around the system. I think that's the one they do the worst on. Yeah, it's pretty bad. It's very difficult. It's a very high standard, but it's one where it's very challenging. I've been really fortunate to have gone on many CFSRs, and you know you can see many of these cases where kids are moving around the system in various places. So placement stability is very important, probably for those of you who are, everyone it's important, but probably foster care managers would probably want to take a close look at this. Whoops. What surprised me and also surprised Linda was I'm looking at foster care exits here because that's where you get a full count of how many moves they had. Almost half the children had no moves. I thought that was kind of a surprise, that almost half, 45% of the children in 2007 had no moves. I have, by the way, excluded from this analysis, although there aren't a whole lot of them, but the interstate placements, kids who were in an interstate placement. The reason I excluded them was because they almost automatically have at least one move, and they probably should. I mean, because there's a lot of work has to be done for an interstate placement. Whether or not they should have any more than one is another story. But so I've excluded them from the analysis, trying to keep this kind of clean analysis. They aren't that many that it would make huge differences here, but they would fall probably at least into the, this should be 1 to 3, not 2 to 3 down here, by the way. 1 move to 3 moves. I find my errors as I go along, so please mark that, 1 to 3. But anyway, 45% of the kids had no moves. Now remember, a lot of the kids who are exiting are kids who are very short-termers. We have a lot of very short, if you look at the exit curve, it goes like that. It's very steep. It's a very steep curve where kids really shoot out of the system very quickly and then they dribble out later on. So it may be a function of how quickly kids leave the system. A lot of kids leave the system. A little over a third had between 1 and 3 moves. And what is that, 19%? 19% had 4 or more moves. Those are the kids we tend to look at. It turns out, we'll see with the 1 to 3 moves that in many respects they actually look like kids who don't move at all, which is kind of interesting. Okay. In terms of racial ethnic groups, if you look at this over time, there really isn't much difference in terms of their distribution in each of these groups. The African American children constitute 25% of the no movers, 26% of the 1 to 3 movers, and 31% of the 4+. So that's slightly higher. The Hispanic children drop down in the 4 to plus are only 17%. And the whites are just pretty consistent at around 45%. If we look at removal ages, something that for those of you out there in the field probably aren't surprised about, that the high movers tend to have been removed in older ages. I remember, I've never been in practice. I was trained as a researcher, sociologist. And I remember one of the first CFSRs I went on, we'd been getting the AFCARS data in, and we would see these kids, with 16 moves in a year. I thought they were data entry errors. And I thought, oh, the data are dirty. And then I went out and read cases of kids, who came into care at 13, and found these cases where kids just blew out of placements every month. So those kids are the ones represented by the yellow bars down there at the end, are kids who enter care late and they have many, many moves while they're in care. The younger children are more likely to be in the none or the 1 to 3 moves. If we look at discharge reasons, we can see again 29% of the kids with 4 or more moves emancipate. That's almost 1/3 of those children actually emancipate. What I think is particularly interesting in this particular graph is adoption. That the adoptions represent 22% of the 1 to 3 moves, as well as 22% of the 4+ moves, which really gives the impression that the kids in the adoption stream do a lot of moving, and that it's pretty equal between the 1 to 3 and 4 to plus. We have not 4+. We've not really found that in other groups, but clearly for the adopted kids, they are doing an awful lot of moving around. It's not, which I was kind of surprised, and it isn't just, one might expect the 1 to 3 that they would have a move, say, a placement, and then one move to a pre-adoptive home. It's clearly more than that. So that might be something the adoption managers want to look at as well. This is the distribution of discharge ages, and again, not a surprise. The kids with 4 or more moves are generally kids who are discharged at older ages. So it's very much age-related, as are many other things in child welfare. And if we look at time in care, those who, again, back to the short-termers, those who had no moves, who stayed in the same place, their average month in care was 10. For those who had 1 to 3 moves, it was 20. And for 4+ was really almost 4 years. So they were moving around for 4 years. I'd like to stop it here and see if you have any questions before I go into this, because this gets a little more complicated. If you all have any questions at this point, anything you want clarified. Yes?
Hi, can you hear me? So for the slide with the adoptions and showing the
22%?
Yeah, the 22%, could that also be take into account some of the older kids now who've moved around a lot, who are getting adopted, who might not have years ago been adopted? Or, well, I mean, you're only looking at recent data on this.
Well, the data do not show that older kids are getting adopted in any greater amount than they have been.
Okay.
So although that would be a good hypothesis,
Right.
the data doesn't support the underlying assumption or assertion
Right.
that older kids have been pretty stagnant. In fact, it's going down. The proportion of kids adopted who are older, which our definition of older is 9 or older, has gone down in recent years. So, but that would be a good hypothesis to test. So, very good to test it. But the adopted kids are 22% of the total, whether it's 1 to 3 or 4+. Maybe somebody else has a insight into that. I was really surprised to see that. Maybe I guess we need to say that I don't know. I don't want to get into it. Well, you can get into it. I don't want to get in trouble. Sometimes stuff happens, and you just, in the data. Those of you who have worked with me for years know what will happen if people will raise the questions. I go back and start to figure out what's really, what else is in the data. I wanted to move into this issue of post-adoption placements as well as dissolutions. Now, the AFCARS data are pretty dirty with regard to both of these things, so I had to do a lot of cleaning. What that means is, for example, there are in the database kids who enter care at age 1 who are identified as having been previously adopted, who have had their adoption dissolved and they've been readopted and they're age 1.5. And that just is impossible. You know, they've been just identified incorrectly. So I go through, to get to these populations, I go through a rather extensive cleaning it up so that what's left are things that make sense. That there's at least some period of time for a previously adopted child before they're TPR'd again and adopted again. Or in terms of the post-adoption placements, that their adoption date did not occur after they entered care. There's a lot of logical problems with it. But I'm pretty confident that I'm sort of there. It's not, I think that that's why you'll see in terms of the numbers, they're kind of strange. But the percentages and what they say, I think, are meaningful, even though the populations might be a little strange. Now, one of the positive things about this, that even before cleaning, but certainly after cleaning the data, there are so few of these that looking at 1 year doesn't really tell you much. And there really is no trend. So what I've done in these analyses is to put together 8 years of data for each of these groups. Rather, I just put them all together because so I could have enough to run some analyses that might make sense. And there's no evidence of any increase or decrease, so you can sort of get away with that to get a big enough N. For the purposes of this analysis, we're talking about post-adoptive placements, or PAPs. Trudy Festinger and I have written a paper on this, trying to change terminology, so I'm asserting this terminology here. And this is the removal of a child from his or her adoptive home and placement in foster care. And it can be a voluntary or involuntary placement. And dissolution is the removal of the child from his or her adoptive home and placement in foster care. In addition, the parental rights of the adoptive parents are terminated either voluntarily or involuntarily. Right? So this is the child who comes back. Yes? I think it's very likely that it's unreported. Yeah, underreported. It's both overreported and underreported. What we're trying to do is to make the best of the data that we have, because nobody has national data. This is as close as you get. You'll see that a lot of it makes a lot of sense, so we'll look at it here. One of the big typos here, dissolutions, if I look at 8 years of data, dissolutions are not 95,000, it's 5,000. Okay, it's 5,046. And the PAPs are 25,000. PAPs are PAPs only. Rather, I've separated out those who just remained PAPs from those who were dissolutions. So you base it, so 25,000 in terms I'm able to come up with looking at 8 years of data. So totally it's around 30,000 kids who came back into care. Now, if we just want to do a slight calculation here, during that period of time, well over 2 million kids entered care. So it's a very small percentage. Even if there's massive underreporting, it's not going to be huge. But they're a very serious kind of case. These are very serious cases in the sense that the system has been involved with these children and their permanency now is at risk. So we can see that of the total 100% of kids who've re-entered after having been adopted, 83% were PAP-onlys and 17% were dissolved adoptions. There you go. If we look at the racial ethnic distribution, African Americans are slightly more likely to be dissolved, and whites somewhat less likely to be among the dissolved adoptions. And Hispanics are slightly more. If we look at the age of removal, this kind of gets real interesting here. The kids who end up as a dissolved adoption overall tend to be removed at younger ages, while the kids who are PAP-onlys are removed at much older ages. That's far more clear. But they're kids who are coming into care at older ages. What you can't tell from this data is the likelihood of having a dissolved adoption a function of age of entry. Rather, we don't bother going for dissolutions for children who are coming in at older ages because we don't think they have a probability of being readopted. Because what we're going to see here is the kids who are dissolved, and again, who come in at younger ages, have high probabilities of being readopted. So is it our, meaning the system, I'll represent the system, assessment of the likelihood of their readoption that drives the decision to whether or not to go for additional termination? So that's just we can't tell in this data sort of which came first, the chicken or the egg here. Current placement settings, as you can see, those kids in dissolved adoptions, whose adoptions have been dissolved, 13% compared to 3% of the kids who are PAP-onlys are in pre-adoptive homes. And our pre-adoptive home thing is a very underreported piece as well. The dissolutions are more likely to be in non-relative foster care and slightly more likely to be in relative foster homes. On the other hand, the PAP-onlys are more likely to be in group and institutional care. Again, probably a function of age of entry, which is where those placement settings are more frequently utilized. Okay. Now, this is looking at the kids who exit based on whether or not their PAPs are dissolved, post-adoptive placements are dissolved. The ends up here look real different, the ends, the 17,000. Those are correct. Those are the correct ends. And it has to do with how the data got cleaned and who got removed. And so in this case, we have about 34 exits. So we had about 30,000 entries. We have about 34,000 exits. Again, it has to do with getting these strange cases out of the database. And we're going to look at among children exiting foster care. I took this is, those of you who use Excel, one of the problems of Excel is when you have things that are real close together, it makes it look giant. But I wanted you to be clear, they're really almost equal, these exits, as you can see up here, between PAP-onlys and dissolutions. They look weird like this because of the way the computer program works. And there is a way to adjust it, but I forgot to adjust it. The dissolutions is also around 17,000. Okay. Again, it has to do with how the data got, the way I cleaned the data to get these weird cases out of it. Okay. So if we look at the largest racial ethnic groups, we can see that African Americans are slightly more likely to be dissolutions, as are the Hispanics, and the white non-Hispanics are slightly more likely to be PAPs of those who exit. Again, I don't see race as a driving force here. I actually see age, my usual age thing, as being a far more significant factor in this than race ethnicity. Here's a distribution of ages at exits for PAPs versus dissolutions. And as you can see, I mean, this is really clear. The dissolutions exit at much younger ages. The PAPs are exiting way, way down in the teenage years, and the dissolutions are exiting at much younger ages. Again, many of these PAPs appear, this is sort of not a surprise, may be coming in for service needs, group and institutional care, residential care, and the only way to get it for the parents is to have the kid back into foster care. We certainly know that that's a policy in many states. And so a lot of what we're seeing here, there's always, the reason why this is a critical question, there's always been an underlying PAP population that were kids who were adopted, who went back in for the purposes of receiving particularly group and residential care, maybe even even specialized foster care. That certainly would be it too. That was always there. But people thought that ASFA would generate you would have all these bad adoptions and thousands of kids would now come back into care. There's just no evidence of that. But we do see this difference between the kids who are PAP-onlys, who are older, who seem to be more likely in group and residential care, versus the kids who end up dissolved, who come in younger and exit at much younger ages. And if we look at their last placement settings, we can see that 2/3 of the dissolutions are in pre-adoptive homes. And pre-adoptive home is an underreported category. But 2/3 of the dissolutions are there. And in every other category, the PAPs exceed the dissolutions. I mean, it's just really dramatic how many of them are at least scheduled to be readopted. Okay. Their months in care, the PAP only is 18, and that's likely because they enter later. Kids who enter later have shorter lengths of stay. And dissolutions are about 3 years for dissolutions. And here are their discharge reasons. Not a shock given everything else we've talked about. 85% of the kids we were able to identify as dissolutions end up adopted. 54% of the PAP-onlys are reunified, and 24% get emancipated. And again, that's very much, first of all, the rate of reunification isn't too bad, but the emancipation rate is certainly a function of age. In the database, it's my fault we did it this way, we did ask at what age was that previous adoption? How old was the child when previously adopted? And we asked it in groups. We didn't ask exactly the age, what groups. So the groups that we have in the database are less than 2, 2 to 5, 5 to 12, and 13 years or older. Okay, and those are the age groups. If you look at this carefully, and we're looking here at the PAP-only entries, PAP-only exits, dissolved entries, and dissolved exits, particularly if we look at these exits. What it says overall is that it almost doesn't matter much at what age the children were adopted. That even the young children, particularly when we talk about the exits, their exit ages are still about as old as the PAP-onlys. Rather, it has all kinds of implications for post-adoption services. If a family thinks they're getting a 2-year-old and that everything's going to be fine from now on, what this data says that if there's going to be problems, you may not see the problem until the child, in this case, is 7, 6, 10, or you might, in terms of the PAP-onlys, 11 years old, 13 year, pardon me, no. You're going to see kids come in at much older ages, 13, 14, 15. So the age at entry the age at which the adoption occurred, at least in terms of these gross categories, is only one factor, but that it may take quite a while between when issues surface before the child comes to the attention, again, of the agency, or at least there's seeking services from the agency. So this is, I think, something we need to think about, that just because you adopt a really young child doesn't mean that the issues aren't there. Now, I want to reiterate, it's a very small number that this happens to. So what are the practice implications of these findings? Of course, Linda's going to answer that question. About 1 in 5 children who enter care for the first time are infants. The most frequent circumstance associated with their removal are neglect and parental drug abuse. They're also more likely to be placed in a foster home. In contrast, children who are re-entering care are older. In addition to neglect, are more likely to have parental inability to cope and child behavior problem as circumstances associated with their removal and are more likely to be placed in group or institutional settings. Again, the big age difference, and that has all kinds of implications for services. Almost half of the children who exit care have had no placement changes. More than 1/3 had, it should be 1 to 3, and almost 1 in 5, 19%, have had 4 or more. Children who exited care with less than 4 moves were younger than those who exited with 4 or more. Those with fewer moves had shorter lengths of stay and were more likely to be reunited or live with relatives, while those with 4 or more moves were more likely to be emancipated. Children with 2 to 3 moves and those with 4 or more moves were equally likely to be adopted, and I thought that's sort of interesting. Among children who enter care, PAPs are older than dissolutions and are more likely to be in group or institutional placement settings. Among children who exit care, dissolutions exit care at younger ages are far more likely to have resided in a pre-adoptive home prior to discharge, have been in care twice as long as PAPs, and predominantly exit to adoption. In contrast, PAPs are more likely to be reunified or emancipated and exit care at older ages. On average, PAPs and dissolutions are likely to enter care during the preteen and teen years, regardless of the age at which they were adopted. So there was a question in the back. I'm happy to answer the questions now if you go to a mic. Somebody way back there? Can they go to a mic? Okay.
Yeah, it's green. There we go. All right. I just had a question about, for the adoption kids, did you look at reasons for removal and to see if there was any trends or patterns with?
There were no trends. In fact, I kept this out because it was getting too long. There were no trends because I didn't look at trends because there were so few cases. But specific, I don't think I have it in here, no. Okay. The problem, I do look sometimes at reasons for circumstances of removal for exits. And in some ways, the exit data on that was far more interesting than the entry data. But the exit data, and some of the problems of it, the way we're currently structured is sometimes those circumstances are way, way, way in the past, and not sure whether they're proximate causes of anything. So, but whatever. That's a very good question. Thank you very much. I'll take a look at that. I think I did look at it and didn't see anything, and may have seen what you see for everybody else, but I'd have to look at that. Thank you very much.
It looks like to me, and from my experience, I'm the adoption manager for Kentucky, a lot of this boils down to teenagers being teenagers, doesn't it, really? It's, you're talking about they're older when they enter care. They have behavior problems. What teenager doesn't have a behavior problem? What parent doesn't feel an inability to cope with a teenager?
Well, yes, the age, I think that's what I'm trying, I mean, you got the point. The point is that you really have at least 2 groups of kids that may require very different kinds of interventions. Families dealing with different things that require different interventions. And I think it's driven by age. What I see is something driven by age at removal. So I agree with you if that's what you're saying. Is that what you're saying?
I don't think it's so much age of removal. I think it's when they hit those teen years is when they start development. Yes, thank you.
Okay. Yeah.
Can I go back to the slide about, excuse me, the slide about the distribution of current placement?
For whom?
For PAP and disillusionments. Mm-hmm. I'm a little confused about how a PAP could be in a pre-adoptive home.
Well, that could be a legal risk. It could be a legal risk placement.
So the PAP, even though the plan was reunification with the adoptive parents, we might not yet have gotten to the point of TPR.
That's right, even though these are last placement settings, and it's possible that the TPR dates didn't get in. Sometimes they're entered later.
So then they'd
Or it
actually
could
be
be just-
disillusionments instead
Pardon?
of, so they would have actually eventually
Been a
become
dissolution.
disillusionments.
Eventually,
Okay.
in order to be, unless they could have gone from a pre-adoptive home, say, to a guardianship. That's a possibility. It might have turned into, I've seen that happen, where they're in something called a pre-adoptive home and they don't get a TPR and they end up in some sort of guardianship. Or it could be an appealed TPR and they decide to go to a guardianship. We don't get enough information. You all in your state systems have that kind of information. We don't get enough detail to go into that, but it's likely that's the kind of thing that happened. Or it can be a data entry error. Certainly a data entry error. There are many of those. But we hope they're random. That's part of how we get around it. They're random. Do you have any other questions? Anybody else? We're going to have more questions later. My colleague, Linda Arnold, now will talk.
Okay. Thank you, Penny. And believe me, I'm not going to give you all of the answers and implications for practice. I hope that I just give you some more food for thought. It is great to be with you, but one of the things that I want to say, I have presented with Penny before, and so it's always a challenge to present after Penny gives all of this food for thought and is such a great presenter. Plus, I'm doing it after lunch. So, and we know it's on everybody's favorite topic, data. But I think Penny gave us some really good things to think about, and I just want to pursue it a little bit. Take it to what happens when you take it back to your state, and what does it mean to you, and hopefully I'll give you just a few things to talk about maybe. And first, I just want to ask you, what was the most compelling information to you? I think we heard from some of the adoption managers, some of the questions that we got. I'm going to talk a little bit later about some of the most compelling things to me. But I think not just compelling in, gee, that's interesting, but gee, I need to look at that when I go back to my state. I wonder how we do look in comparison with the national data. So I want you just to take a second. If we had time and this wasn't being recorded, we'd talk about this a little bit more among the groups. But right now, if you would just take 1 second and just write that down. And I want to do that because I think you've got, at the end of the sessions, at the end of this conference, you've got some planning to do when you go back home. And this session being early in the routine, I want you to have that to go back to think about. What does this mean to me? And what is this that I might want to check on when I get back home? Then I just, as you're doing that, want to talk about some of those things that you might do as you go back. And again, using data to improve practice. I've got some things here to talk about. Use the information, and Penny's already said this, from this national data to give you ideas of this is what I want to look at. So when you get back to your state, there are a couple of things. Of course, first you can start maybe running some reports on some of this, taking the examples that she used, run some reports, analyze the data in your way. Now, first thing first is get with your data and IT people. Make sure you're on the same page. Some of these may be reports you're already running, but you may see some things here. I know I certainly saw some things, think, we need to look at this in this way. But make sure that you're on the same page, that you take time to sit down and talk to your data people about what the information is that you want. Again, we're speaking from experience when we go out and meet with states around data and using data, that this is an issue that sometimes that we see. So, but run the reports on your state data and analyze it and look at it in all of the different ways that Penny has looked at it, by age, by race, types of placements. You may have a lot more data in your system that you can look at it in other ways also. Geography, you may run it by your regions, by your counties, your larger jurisdictions. The other thing is, don't forget the qualitative data as well as the quantitative data. That is so important. That what do your quality assurance or your CQI results tell you about what is happening in your system on some of these things. I think that is extremely important. So anyway, the other thing, and I know that you all are various levels of sophistication in your states. Some of you have very sophisticated ways of analyzing data. Others, you're doing it maybe, and you don't always have the resources to get the number of reports, the information that you want out of your system. So, but one thing is, you don't have to be a statistician to look at these data. In fact, it's as Penny said, you all are the practitioners. You all know what it means as far as the practice. And a lot of times what you need to do is look at the data that your state has. I know we have this all the time on number of adoptions. When the system says one thing and the adoption manager says, I know we had a lot more adoptions than that. Maybe that doesn't happen as much as it used to because data has been improving, but I know that's been a common thing. But you don't have to be a statistician to look at this to see what some of the trends are and what are some of the things that you need to look further in. And then use these results to make changes in your system, or you use them to look at the changes that you may need to make in your system. And I certainly hope that all of you, as you do make changes in their system, that you are looking at your data. And we're going to talk about this a little bit when I go through a couple of examples later. Again, as we're really talking about making changes in practice and really outcomes, and I didn't get outcomes up here, but certainly we're looking at how do you make change in practice. But one of the things is change in practice, as we know, it just doesn't just happen by waving a wand. And so as you are looking at your data and exploring it further, you may have to look at making changes in, it may affect your planning, looking at for example, the age of kids coming into care or the age of reentry of kids. How does that affect your planning? Your policy, your training, your services and your service array. Look at supervision and how that might be impacted, or how you may need to make changes in some of the your supervision, teaching your supervisors or helping your supervisors understand the dynamics, for example, of child development or various things. But just all of these things, I think you have to consider when you are looking at making changes in practice. And the data can inform all of these. So it is really important. I think this morning they talked about making changes in the system as a whole. Data is an integral part of doing that, and data analysis on what is really happening in your system. So one of the other things that's happening right now, budget. Data can really help you as you're looking at budget and what's happening there, to look at what are the data telling us about the budget and our resources, and it can really be something that you would definitely need to look at as you are looking at changing. All of this has to do with changing practice. Now, some of the things to consider, and Penny hit on this as far as quality of data and the quality of the national level data. Now, you all may have some data quality issues in your state. You may not be using all of the data because you say, well, this data isn't any good. Well, I call this the use it or lose it rule. If you're not using the data, it's never going to get any better and it's never going to do you any good. So start using the data and start examining it. And if there are some issues with it, you can correct it so that then you can use it for planning. So certainly the quality of data is something, and I know that many of you are doing that, and I know the quality of data has improved exponentially over the past couple of years. The other thing is data does not necessarily give you the answers. It gives you more questions. Penny pointed that out when she said, I'll take your questions back and look at them. In fact, it rarely gives you all of the answers. It gives you more questions. It may tell you what is happening. You may have a lot of placement moves. It may tell you who it's happening to, but it doesn't tell you necessarily why. You've got to determine why through your CQI results, through reading cases. You know, I always like to say data gives you the big picture. It gives you the quantitative look. Then you've got to look quantitatively to see what is really happening. And you have to look at this all together. And you've got to get the input from those involved in the process. The children, the families, the workers, the supervisors. Now, several of the things I asked you to write down what some of the most compelling things to you were. And I just took some of those that were the most compelling to me. And a couple of those, the first one was that difference in entries and reentries. Who is entering, who is reentering, and why. And then talking about what are those implications for practice. And we talked about that a little bit on the reentry. And of course, the age of kids reentering. Somebody said, well, isn't it because maybe they're teenagers? And how many of you are parents of teenagers or have been parents of teenagers, right? So you can relate to that. I know I certainly can. I'll do a personal story. When we were putting up the SACWA system in Oklahoma, my son was 15. Those years coincided, and I say those are the worst 2 years of my life, when my son was 15 and 16 at the same time we were putting up a SACWA system. I don't know which was worse, but they contributed to my stress level a great deal. But so it may just be age. There can be something to that. But the other side is to look into that and see what's really happening. One of the things that I wondered was, again, parental inability to cope and child behavior as a reentry. Those were high on the reentry. So are these families that just had more serious problems to start with? We don't know what the answer is. You would know after you look at the cases. Look at some of those cases to see. And in some instances, you don't really have that many cases that you have to look at. Your number may be so small that you can do a really good read of cases to find out what is really happening in your system. So, and then what are the implications for practice on reentry? A couple of things I thought about, and we heard a little bit this morning about trauma, but just think about it like, what is our system doing? What is your system doing to alleviate the trauma of when a child comes into care? And I mean, and we all know this, we certainly don't want to do more harm as they come into care, but think about that, alleviating some of that trauma. I mean, has the system contributed to the problem? That's really what I'm trying to get at. Is it our assessment? Did we do a good assessment that we really identified why kids were coming into care? Did we give them, I mean, we get hit on this on the CFSRs all the time. The individualized services, are we giving them the services that are really addressing the issues of why, of the family and child's needs? Then the whole family involvement piece, are we just using that? Again, I think this morning it was addressed, I think we'll address this, that when you have sometimes just that spot, we do a family engagement or we do a family team meeting at these points, at this point, but it's not systematic. We're not really totally involving the family as we should. I mean, all of those things can certainly have to do with entering and re-entering. I'm just trying to give you some food for thought. The trial home visit policy, and states, we know there are states, many practices out there on trial home visits. But in your state, looking at your reentry, what implications does that have as far as your trial home visit policy? And then just the follow-up. You know, when a child goes home, that's one of the most, again, stressful times in the lives of parents and in the child. And so what is happening then? What kind of supports are there? What kinds of services are in place? Again, that are going to maybe assist in keeping that family together. So those are some of the things I think that you can look at, follow up on, and what's happening in your system. One of the things that I want to just put a plug in, that the Resource Center for Organizational Improvement and our Resource Center, Child Welfare Data and Technology, and Steve Preister with OI, has developed a system for looking at service array, and some of you are in this, but and involved in doing that within your state. But this certainly can have as much as far as upfront and preventive services and family preservation services as it can for services for children in your system. But one of the things that at the Data and Technology Resource Center, we help develop a tool as far as looking at the reasons kids come into care from both the NCAN side and the AFGAR side. We call it a family snapshot. But the bottom line is to give you some data to look at. These are why families are coming in. So when you're looking at your service array, you can say, okay, what are the services that we need that can prevent families from coming in? So that's just one area where some technical assistance might be available in that particular area. So now, the next example that I wanted to go to is placement stability. Again, it probably is the biggest question that we get as far as looking at data. States want to know what states are doing well on placement stability, because it is a huge issue out there. So I will tell you, when I saw Penny's presentation, those numbers just about knocked me out. One of the things I thought, okay, this looks like the 80-20 rule to me. 19% of the kids have 4+ placements. Now, granted, there are a lot of kids that do come in and out of the system fairly quickly, as Penny said. But thinking about that, I just think when we're out there and we're thinking about placement stability, we're thinking it's kind of like the sky is falling. What are we going to do about placement stability? And when you can look at it that, again, you need to look at what your state data shows. But if it shows the number of moves, if it's anywhere near close to what the national numbers are, you're thinking, okay, I can look at number one, then this is only 20% of my population. That's a lot different than the shotgun approach if you're thinking, oh my gosh, what am I going to do about placement stability? You can have a targeted approach rather than that shotgun approach. Then you look at the demographics. And again, of the children, of the families, you can look at the type and quality of placements. Yes, you'll probably have some information on quality of placements. And then you also may need to look at the organizational issues. And a good example, if children automatically go to a shelter, that's a placement. Now, I think it is tremendous, all the number of kids that really don't have any moves. And honestly, I really would like to know how states are accomplishing that, and I'm sure those of you that have placement stability issues would like to learn from those too. But even in your own states, what can you learn from the successful cases? What's happening in those cases that is different from the ones where you are having a lot of moves? So learn from each other, but look at your own state and see what's happening in those cases. And several of the things that I think of as far as practice there that may be affecting that, and again, You may be wanting to do interviews. It's, are you looking at, a lot of you have moved to resource families instead of adoptive families and foster families. So has there been a difference in the number of moves since that happened? What about your support for foster parents and adoptive parents? What about the training? Again, all of these things may be affecting your number of placements. So what about worker visits? We all know how important that is. How is that affecting placement stability? So, and concurrent planning, how you're doing on concurrent planning. All of those things can definitely be affecting placement stability. And I know I'm not telling you anything that you don't know, but just how can you glean all of this information from your data? And there is a lot of this that can give you information on what are the kinds of changes we need to make in our system. So now, this is what I hope that you can take away from this. First of all, just use data, both qualitative and quantitative. Look at evidence-based practices when you are thinking of making changes. Talk to your peers. I know that was one of the things that was said here. You want time to talk to your peers. Believe me, I would be asking all of these states, looking at states that don't have, that are able to accomplish no moves as far as kids in care, and would say, what are you doing? How are you being able to accomplish this? Use the technical assistance available. I think this is a great place to learn all about those types of technical assistance are available on the programmatic side, on the data side. One of the things also, engage your stakeholders, internal and external. This includes your courts. It includes your field staff. Your internal stakeholders are so important in this. Find out what they think is happening. Find out what the cases say are happening. Be persistent. Change does not happen overnight, so be persistent. And always, always ask, how will this make a difference in practice? When you're thinking about making these changes and you're looking at it, how does this really affect practice? That is the issue that we have so much. We can make changes, we can make policy changes, we can change our training, we can do all this, but how is it really affecting practice? How will it affect practice? How will it be better for children and families? So that's just a question I think that always needs to be in front of you as you are thinking about this. So the other thing that I want to say, going back to this morning's presentation, is, of course, some of the things when you're talking about systemic change, about data. And, of course, in the past, and I was there, I'm a social worker, I don't do data, right? We can't live without data now. It's an expectation. We have accountability, and it is there. But the other thing is, it's kind of unfathomable how we used to work without having data or the CQI results. How do we know where we're going and we're making improvements if we're not using the data and our CQI results to show that? Or if we're not making those improvements, what do we need to go back and look at? So it is an absolute essential. But it also can assist you in many other ways. One way, we talked about this a little bit this morning. Whenever you have a leadership change, it is so, if you've got the data there to show this is what we're doing, these are the improvements we're making, it can really help that change stay on course. It can also help with your stakeholders, not only getting the input from them, but keeping their buy-in. So it is extremely important. Your judges, your legislators, helping you get the resources that you need, helping you keep the resources that you need. It is just absolutely essential. And again, I am not telling you anything that you don't know. I just am hoping that you reflect back, and as you're looking at your data and really what's happening in your system, that that you'll keep these things in mind. So my last piece, this is one of my favorite quotes that I found, and I think it is so apropos for the child welfare field and for us. It is easier to produce 10 volumes of philosophical writing than to put one principle into practice. It is easier to produce 10 volumes of policy and legislation than it is to put one principle into practice. And that doesn't mean that it's impossible. It just means it's persistence. It's using all the tools that you have. It's using all of your data to make the change that you need. So anyway, if we have some time for discussion, that'd be great. We've got these timekeepers up here, so we got to keep right on schedule, but we got 10 minutes, so we would love to have some discussion for Penny or me.
I'd like to say something. To comment on what Linda said, that I guess as I've been fortunate enough to go around the country and be on a lot of CFSRs, it always is heartening to see that in most states, somewhere they're doing it. Some county is doing whatever it is that you're seeing that you need to do. That there's a lot of stuff going on in individual counties. Say you're seeing at the state level that you have a problem with placement stability. It's real important to look at, we talk about counties, but whatever your local unit is, to see if you can find places in your state that really handles that very well, and to really use that as a resource. Usually, although not all the time, it's in the smaller counties. But I've seen it even in larger counties and cities, that they do something creative that makes things work differently than it does other places in the state. So I think that's another resource you have to really think about. It's important when looking at your data to look at it not just at the state level, but look at it either county or whatever, district offices, however you're organized, and to do some comparison among them and see where it's working. And I think you're going to find in your states that it is somewhere. Now, sometimes it's in such an unusual place, like where they've got 3 kids in care or something, that, it really isn't applicable, but it's certainly worth asking the question. For example, how come they get a placement setting and the kids don't move? For example, places I've seen that happen is where there's a great support system for the foster parents. I've seen agencies that the kinds of services that were provided to foster parents were just awesome, and the kids didn't move. So, there's, it isn't just that they're bad kids. There's all kinds of other stuff, that's going on that can create placement stability. But anyway, I just thought I would add that to look at it at the state level is really missing what may be out there as a resource in your own state.
Yes, and that is very important, and I probably glossed over that, but it is important to look at it geographically and look at those areas where it is being done right and see what's happening there, either through the case readings or through their reports, the outcomes geographically and case-wise. It is, there is a lot of good practice going on out there, and we can learn from each other.
Penny, have you done any data regarding sibling placements together and whether or not that helps with the stability of the placement?
Oh, I wish I have, but we don't have that data. That's something people at the state can do, and I'm so jealous because you can do that. When AFCARS was really conceived about 25 years ago now, and at the time there was this big issue about not having too many data elements. And in order to get sibling information, it really requires a lot of data elements to do that. So we didn't do it. So I'm jealous of you all. I think that's a real important question. I have all kinds of hypotheses about how siblings function, but since, I mean, I could just assert it and do a truthiness thing here and just, well, I'll believe it, it'll be true, but I don't want to do that.
And that is another thing, and I think I probably didn't hit on that enough. You know, you can use your AFCARS reports, the same data that Penny uses, to maybe if you want to compare how do we look compared to what the numbers that Penny puts up. But you have so much more data in your system that you're going to want, whether it's placement, you have a lot more placements types probably that you can break down and see a lot more differences. You can look at your siblings. There are so many more things that you can do with your state data that will really inform you a lot. So I tried to hit on that, but I don't think I really emphasized that as much as I should have, because that is extremely important. You have lots of information that you can dig deeper into.
Yeah, I'd like to, we just support each other all over the place here, but this question about the placement settings, and I think it really would be worth looking at these post-adoption placements to look at how, to really get a handle on how many are coming in purely for services, that there's no intention to relinquish, or, you know, it isn't an abuse or neglect case, but they are coming in because they need services. We've never really, we know that they're out there and they've always been out there, but it would be really interesting to track those cases and to take another look, and is there some other way? Is there some other way than having to bring kids back into the system to get them those services? So that would be certainly one where you've got the information. I don't have it. You have the real information that could really get you some real insight on that.
Any other questions? I remember I heard a gentleman speaking once about data, and he said that data alone does not influence practice. If that was true every morning when he got up and looked at the scale, then that would solve the problem, but it didn't solve the problem. So it's very important for practice and data to work together and inform each other, and then do those things, that vision, leadership, all those things that Chris talked about this morning. Well, thank you. Shall we give them a hand? Wasn't that a great presentation?